When it comes to breast cancer, we know that early detection can be the difference between life and loss. Thankfully, the technology has never been better with the help of 3D mammograms and now artificial intelligence. At Solis Mammography, it's also done in a more convenient and comforting space. Dr. Chirag Parghi shared the premise behind Solis Mammography and how you can also prevent the #1 killer of women, heart disease. Dr. Parghi, we have done a great job of making women aware of breast cancer. However, we still have a lot of women who are dying because they're finding out about it in late stages. We have to do a better job of awareness meeting action. Okay, I'm gonna start with something as simple as this. I literally ran into a few women the other day who said, I didn't get my mammogram in October. I just didn't get around to it. I'll wait till next October. A lot can happen in a year.
Now, we've done a good job getting awareness, but there's still room to get to excellent. Our technologies are amazing. We can diagnose breast cancer smaller than my knuckle.
We almost have 100% survival rate,
Absolutely, when we catch it early.
Yeah.
But it only works if women use the technology.
Another thing I hear is, it doesn't run in my family, so I don't have to worry about it.
That's a common misconception. It makes sense at the surface, right? Okay, I don't have this disease in my family, so I shouldn't worry about it. The challenge is that 85% of breast cancers are the first time in the family. It's a spontaneous disease, which means not having it in your family isn't protective enough. You still need your yearly mammogram.
Yeah, because when you say who's at risk, let's just start with the fact that you're a woman. And there are some men as well.
The largest risk factor is being a woman, and men can also get breast cancer.
Yeah.
It's a complicated disease, but the good news is we know how to find it. The technology is there and it's amazing. We just need to use it.
Yeah, all right. So I know a few years ago there was some confusion that kind of went back and forth on what age a woman should probably get her first mammogram. What age should she do that?
Let's simplify it. At 40 years old, every year. At the very least, every single year when you turn 40. I don't care if you skip your taxes, don't skip your mammogram. Probably shouldn't skip your taxes.
Yeah, right. Probably shouldn't do that either. But with that said, if you think there's something wrong earlier than 40, by all means, you know your body, by all means, go in and check.
Now, statistically speaking, it's not encouraged to screen women under 40 unless they have unique conditions or unique risk factors. If you feel something abnormal, go see a healthcare provider at any age.
There are a number of things that make Solis different. One of them is just the fact that we just walked in here and it doesn't feel like a hospital setting, if you will. It's comforting. You've mentioned technology a couple times, and as we know, in just about every field you can think of, technology has advanced so many things, and now that technology includes AI.
Yeah.
So when you say technology, you use, number one, 3D mammography with AI technology. 3D mammography is kind of the platinum standard, if you will.
Yeah. At Solis Mammography, we've been early adopters, and it is game changer. We can find tiny spots of breast cancer, tinier than my knuckle, and we can diagnose it accurately, confidently, where we couldn't before. But all of this only works if she uses it.
Yeah. But when you find it that early, that most of the time equates to a life saved. All right. The other killer for women that a lot of times women don't think about, in fact, the #1 killer of women is heart disease. And so you all are doing something that's pretty cool here. It's like you talked about honoring time and the whole bit. We can, that whole phrase of killing two birds with one, not that I want to kill a bird, but killing two birds with one stone. You have a thing where it's the mammo and heart.
Yeah, we are obsessed with patients. We want all the women in our communities to live for decades of every disease that we can find. And what we're learning is there's a finding on the mammogram called breast arterial calcification, and it's where calcium deposits in the arteries of the breast. We used to ignore it, but now evidence is showing it's risk with serious cardiovascular disease, fatal strokes, fatal heart attacks, and all-cause mortality. So we're empowering women to find out if they have this one.
Yeah, and a lot of times patients will say, I don't know if I want to know. Yes, you want to know, because when you know, you can do something about it. You can prevent something from happening down the line, and you encourage them to take the information they get and take it to their primary care physician or whatever specialist they may be working with, and be able to say, here's what I have here. Now let's put a plan together so that I don't have to actually march toward this outcome.
Knowledge is the key elixir to fear. And not knowing can maybe medicate your fears, but it can keep you from living decades. We want you to get ahead of it. We want you to get in the driver's seat. We want you to ask every question and know every risk factor about yourself. We want you to continue living for decades, and that's the path there.
I'm going to round out with, even if you get a yes, it is breast cancer, but it's early or maybe even a little bit later stages, we at least have technology and treatments today.
I told the patient this morning that I think she had breast cancer. I say this is good news because we're finding it early. It was going to be there either way. 1 in 8 lifetime risk in getting breast cancer. You might as well find it early.
Yeah.
But again, like a broken record, this only works if women use the technology.
Dr. Parghi, thank you very much for sharing time with us today with a very important message. If you didn't get it done in October, guess what? You can get it done now.
Everyone. I don't care if you're busy, if life is busy, go get your mammogram. When you start at 40, get it every year. Save your life.
Early detection is the best defense against breast cancer, as we keep saying. So don't wait to get yours. Schedule your mammogram screening today with Solis Mammography. Solis Mammography. Call 833-510-9419. Again, that's 833-510-9419, or visit them online at solismammo.com.